but those are the ones that are registered to have ophthalmology residency program. Now, what about ophthalmology in the US? One thing just to mention about those, the process is very different between those all those university programs, depending on whether they follow an American system or a French system or other systems. That a bit changes the number of years, and it affects also the way the application is done and the way the selection is done. So the details for each one of those, if you're interested, we can go over them later on, although you probably know a lot more about some of them than I do. Ophthalmology in the US, because I do get lots of people asking me, lots of residents from and medical students from all universities asking me about ophthalmology in the US. I'm going to mention a bit some of the statistics and what needs to be done. As you probably know, ophthalmology training in the US is 4 years. The first year is a transitional or a preliminary year. That's a year we have the same at LAU. It's a year where you do internal medicine, ER, and you get to rotate in dermatology, radiology, and any other specialty that you want. And after that, there are 3 years of residency. And those are mostly in ophthalmology. Each program, each university hospital is different in terms of the location that residents are during those 3 years. After residency, fellowship, I guess, is the same, although some countries have different number of years for those. This is in the US, and for programs here in Lebanon that have fellowships, although we don't have all of the fellowships. This is usually the length of years for fellowships. So for anterior segment, most of them are 1 year, and that includes anterior segment, cornea, glaucoma, neuro-ophthalmology, pathology, pediatric ophthalmology, and uveitis. The longer fellowships are oculoplastics and retina, and those are usually the heavy surgical ones that require an extra year. Just some statistics, because also a lot of people ask me about this. Some statistics about the US applications. So if you compare, this is just over the last 10 years, from 2012 to 2021. The number of applicants that were registered during those years. And what we care about the most is the number of IMGs. So if you go down to matched applicants and you look at the IMGs, you see that the number of IMGs that match is usually very low. There are very few years where like the highest year was 2020 where it was 29, unclear why, but most years it's very low numbers of foreign medical graduates that match. And if you see the percentage of the whole people who match, it's usually somewhere between 3%, 3 to 4% on average. So what are the requirements and how to prepare for applying for ophthalmology? I'm going to talk a bit here. We're going to go over like a recommendation that was done for the American medical students. Some of it applies to us and the other part does not. The first, so one thing that I advise everyone to do is you have to plan things ahead of time. As you know, ophthalmology is a very challenging and a very competitive field. So for those who are interested, you should not be discouraged by the fact that it is very competitive. However, you should be prepared and you should start your preparation from the first day in medical school or from the first day you know that you're interested in ophthalmology. Now remember, most people start medical school and they don't know what they really want. So this is a strategy that applies for all specialties, but if you know what you want or whenever you decide what you want, then it's good to focus and let everyone around you know. It's very important to seek counseling from advisors and ophthalmology faculty. So ask as many people as you can. Seek advice from more senior med students. Residents should be your best friends in terms of giving you as much information as possible and help you guide you towards who to talk to and the process. And of course, ophthalmology faculty will be the ones who can channel you better and who can guide you better to make the decisions and plan things along the way. Scores are very important. Grades are extremely important. It's a very good thing to do. Start doing what you need to do to get good scores, whether studying. Each person has a different way to study, attending classes, all of those things. Because at the end of the day, whenever any program receives applications, they're going to look at several things, but the things that are objective, such as scores, are going to be the easiest things to look at because, again, those are objective. So that's very important. Work on your extracurricular activities, and that should be something natural. It shouldn't be something that we're doing to prove a point. At the end of the day, our life should not just be about studying or medical school. We should have other extracurricular activities that are important to highlight when you're in medical school and when you're thinking of applying to anything, but specifically competitive field. It's important to plan when you're going to take your steps, whether when you're going to take your exams, whether step 1, step 2, or the IFOM exams, or any exam your university hospital relies on for applying to any program. And that's very important. Study for those tests. And if there's one advice I can give you that I have lived myself and I've definitely seen lots of my colleagues struggle with, is set a date for your exam, no matter what exam it is that you're taking, and just stick to that date and do it. It's very easy to keep postponing and keep feeling like you're not ready yet. But it's very important to just stick to a date, prepare for it, and do it, because you're never going to feel 100% ready. And usually your scores won't change whether you postpone the exam or not if you have done your job and studied. So other things that are very important along the way, sorry, this is a very long and boring slide. We're not going to go over everything, but it's important to do electives. So if you know you want, let's say you're interested in coming to our program, to my program, to LAU program, you have to show interest. Try to do electives, try to contact the residents, try to come at least to some of the grand rounds. I know now it's a bit different with COVID. However, it's also easier because you can just ask about things online and just join grand rounds, meetings, conferences, and that shows interest. And it's not just to show that you're interested, but to show that you're serious about pursuing a certain program. And of course, if you're leaving, if you're planning on going to the US or any other place, then you should also try to ask people there and try to go to those places and do electives. Because again, anyone, if I have two residents who are exactly, two applicants who are exactly the same or similar enough, I'm always going to prefer the one that I know, just because they have all the credentials and I know them. I won't have any surprises. So getting to know the program, opening up, talking to people is very important. And just knowing the process, knowing what to expect with your application. Know the deadlines. Like if you're applying to the US, you have to know that it's a different match process. You have to know the deadlines. You have to plan things ahead of time. And we're all good at planning things ahead of time when it comes to studying. Otherwise, we wouldn't be in medical school. But just make sure you have things planned as they should be. Now, the residency experience. And if you have any questions here, please feel free to interrupt. Residency experience, I personally loved my residency experience, and it's very important to be in a program where you know you're going to have fun in those 4 years. How to determine that? It's going to be based on who are your co-residents, who are the attendings and the faculty who are giving those lectures, who are there in clinic, who are staffing your surgeries. That's very important. I can talk about several, like our program, but that's the same for a lot of the other programs. Very important to focus on a residency program that gives you enough exposure. And enough exposure in surgical fields is not just like any medical field. Surgical field mean that you need to make sure that as a resident, you'll have enough experience and enough exposure as a first surgeon. So not just as observer, and that's extremely important. It's also very important to make sure that you have enough exposure in clinics. So the more faculty from different subspecialties, the more exposure you have. So I need someone in a department to do retina, I need cornea, I need glaucoma, I need as many fields as possible to be represented because that's important and that affects what you're going to be, how your training is going to be. And the third part is what clinics you go to outside, whether dispensaries, المستوصفات كلها, those are very important ones to ask about because those are the ones where you're going to be working independent of anyone else. You're going to feel what it means to have your own patients, you have your own clinics, to run a clinic. And those are the ones that are going to help you learn the most. Work atmosphere, just like everything else, the work atmosphere that we're in is something very important because you want to make sure, again, those should be the most important years of your life because you are at the age group where you have just finished medical school, you're preparing for your career. So it has to be a good place, pleasant place for you to enjoy learning, to enjoy having people around you giving you constructive criticism. You want to make sure you're not in a destructive environment where people are just using you to fill out paperwork or do things like that. That's very important. Again, it is your right as someone in training to be trained, to be taught. Otherwise, you can go and do something else. So make sure you ask for that and make sure you demand it if it's not available. And make sure that you feel comfortable in the place you are. Otherwise, you have to try to change that atmosphere around you. What are the main keys of success in this field? I would say, like any field where things are competitive, being serious, showing interest, being a hardworking person, following things as much as possible. And I think the most important feature and the most important thing that you can have is showing that not just that you're interested, that you are capable of self-learning. Most of the things that you're going to learn are not just going to be from what you see in clinic, going to be from what you read on your own and what you study on your own and what you research on your own. So those are very important keys for success. And the other thing is don't accept mediocrity. So don't accept when things are just mediocre. And this is something, unfortunately, that I noticed a lot in Lebanon, whether physicians, whether residents, whether everyone, if you set a high standard for yourself to succeed, it's not just that you will succeed, you will force people around you to lift up their standard, to act in a more superior way, to deliver better care for patients, to deliver better teaching for residents and students around them. So this being proactive is, for me at least, the main key for success in any field, but in ophthalmology specifically, because there's a lot of time where you're on your own. So it's not like internal medicine where every morning we're going to come together, sit together and do rounding. We're not going to round on anyone. So if you don't have the interest in learning and in searching and looking for patients and asking, then you're not going to learn and you're not going to succeed in that field. And again, planning, for me, planning is key. Having a plan, not with the details, but a long-term plan on where do I see myself in 5 years? Where do I see myself in 10 years? And do things accordingly. Now we get to my favorite part. What are female engagements in this field? Of course, just like most fields, there's still a lot of gender inequality, even in ophthalmology. And that's something, of course, that has improved a lot over the years. However, there's still a huge deficit in that. I'm going to talk a bit about the concept of the leaky pipeline. And the reason why I talk about this is because it represents a lot what happens to women throughout medical school and then throughout their career. And I want to highlight it because I want to focus at the end on how we can all together change that, men and women, to try to promote an equal environment and a more fair environment for everyone. So as you probably know, women make a big part of healthcare workforce, 70% of the healthcare workforce, and the proportion of men to women entering medical school is now approximately 50-50. So you would think that this 50-50 would continue over their career. However, that's not the case. So as while almost half of the assistant professors in the US are women, that's not the case in Lebanon yet, of course, but only about a third of those get to full professors, and even fewer are heads of departments. And this is a problem across all fields, not just medicine, that there are very few women in leadership positions. Of course, there are lots of reasons for that, but it's important to highlight why this is the case so that we can try to work on it and improve it as a community altogether. Another thing, women are less likely to write journal articles and are less likely to be on editorial boards or to be speakers at top level conferences. All those are alarming, and all those should push all of us, men and women, to try to change this to make the whole work environment a better place. So does this mean that women are less capable or less ambitious than their male counterparts? Of course not. Several studies have shown that post-operative surgical outcomes, as well as morbidity and mortality, are slightly better for female surgeons. So it's not that they're less capable. But it's also important to note that this does not mean that women are better surgeons. It just helps debunk the myth that everyone, I'm sure all women on the group now attending this have witnessed or have lived this, where people think that women are worse surgeons, that a lot of patients come to a woman and like they don't want to do surgery with a woman, they just go to do a surgery with a man. And it's okay. It's not, things don't change suddenly. Things need time to change, but they won't change if we don't try to change the whole culture of this mentality. And we have to be the driving force for that. So why this gender inequality? When we think about gender inequality in any profession, we have to focus on several things. First of all, payment. Of course, payment is a big part of inequality between men and women. And I'm going to talk about this a bit later, because it's not like a man and a woman apply for a job and then someone will come and say, okay, you're a man, you're going to get 100, and you're a woman, you're going to get $50. It's not like that, of course. It's a very complex situation, and I will be talking about that a bit later. The second thing is treatment at work, and I want to focus on this also. If I don't know if anyone, whether males or females attending now, can just share any of their experience at this, where they feel that they were treated differently at work because they were females, or they saw that their colleagues, their female colleagues, were treated differently. Does anyone have any experience with this? Have you lived something like this? Anyone? Is anyone hearing me?
Yes, doctor, we are
Yes,
hearing.
we are hearing.
Okay, I just want to make sure.
Yeah.
So is anyone interested in sharing anything from their side, or?
Yeah, anyone, don't feel shy. You can just open your mic and share with us your experience if you had something like that.
Me personally, I witnessed something at a hospital in Lebanon when I went to the ophthalmologist. So
Mhm.
the thing is, I was there waiting for my appointment, and there was a woman who came to the department because she had I think, a checkup or something, and she asked for a doctor, and he was a male, but he wasn't there. And there was another ophthalmologist, and she's a woman, and she's, منيحة كتير. So they told her إنه he's not here وفي the woman ophthalmologist, the doctor, and she's excellent and etc. She started shouting in the middle of the hospital that she didn't want a woman and women are incompetent and stuff like that. So
What did you do?
nothing.
It's hard. It's hard to say something because in a way you don't. You feel like she has to be crazy to be saying something like this. But at the same time, I feel like it's important not to be aggressive at answering back, but to be proper and say, maybe ask her, like, why do you feel that way? Or try to say something like, listen, you have to be more respectful. Otherwise, we cannot see you here. And those are very important because it's doing small things that changes the whole perspective. I did, and I don't know if any of you follow me on social media. I did a campaign for women's mental health that I launched on International Women's Day, March 8th. And there are lots of people who participated by talking about their own mm, experience with mental health issues, especially this year, whether depression, anxiety, postpartum depression, all kinds of things. But the interesting part is I got lots of messages from medical students and residents just describing incidents that they had that they described as harassment um, at work. And I'm sure you've had like a male physician tell you, talk to you in a different way or treat you in a different way just because you're a female, whether something good or bad. Either way, it's discrimination. And I think it's important to start speaking up a bit about those things to try to change them. So this is what I mean by treatment at work. When you are not treated the same way, women are usually asked to do different tasks than males, although both are physicians. Plus, I'm sure you noticed like patients would call you Habibi or send you kiss, and they wouldn't say that for a guy. So, anyways, again, this is not a problem, but if we can make a change, if we decide to make a change, because it's not this, it reflects on a bigger level, it reflects on a career for a woman. Also, inequalities apply to responsibilities. What are the things given? What responsibilities are assigned to men and women? Mentorships, of course. And all of those affect progression, opportunities for career progression, which explains why we don't have so many women in leadership positions. So let's start with talking about payment. The first fact here is funny because the Association of Women Surgeons reported that at the current rate, we will not reach equal wages until the year 2152. And it's funny because we're not doing much of an effort to change it. So on average, women earn approximately 90% of what a man earns until the age of 35. And after that, the gap widens even more because men go up in ranks and women tend to do that less. Now, this does not mean that men are doing something wrong. As I said before, it's not like two are applying and if you're a woman, you're going to get less. No, but women tend to accept offers and tend to do less negotiations than men do. So if I come and tell a woman physician, I'm going to pay you $10,000 a month, she's going to say, it's very like feel, that she would just accept it. Usually, men are better at picking up, negotiating, and asking for more. And this is why they end up getting more. So, this is something that we have to accept, realize that we do it. That's not just for pay, for everything. We tend to negotiate and push less for things and underestimate things that we have and things that we do. The other part, and this is a huge problem, and I know this from my residents, I know this from my students, because medical school is so long, it happens that our peak childbearing years are usually either during a residency or right after residency or early in our career. And this has a huge impact and is a huge challenge for women in general, because if you don't have someone to support you and tell you, I am going to share equal responsibilities with you, usually women tend to choose their family over their career, mostly because they have decided that, not because someone told them you have to do that. And this is also something that we have to learn how to fight better and set our priorities better. Asking a woman what her family plans are during a job interview is not permitted. And I really hope that any job interviews you're doing or any residency position that you're applying for, that you don't accept anyone asking you directly or indirectly about family plans. Because usually what that means is, are you planning to have a baby in the next 3-4 years? And this is an unacceptable question, because that means they are going to use that to determine how they're going to rank you. Because of course, it's easier to hire a man if you're very short-sighted. It's easier to take a male resident and easier to hire a male who's never going to take a maternity, who's never going to be pregnant, who's never going to need to breastfeed. So that's only if you're short-sighted. But if you have the vision to look toward the future, you know that that short period is not important in the bigger picture and for the better of society in general. Another thing, and this is something common, and unfortunately women do that damage to themselves, is if you have two candidates, okay, I have two medical students applying for a residency position with equal qualifications, usually men have a higher chance of taking that position, just because women are put in a position where they have to choose whether they want to do surgery or they want to continue with their family plans. And this is something, I'm not saying it's easy to fight, but I think it's something, if we are all aware of it, males should support and help, and women should ask for help and say, my career is as important and I can do all of those at the same time without feeling guilty about it. And then this part, and this is something I see a lot. I see a lot even with my medical students, and I always point it out, that we tend to downplay everything. Not just, here we're talking about leadership roles, but we tend to downplay what we know, we tend to downplay. So if I ask a question and I have 10 medical students with me, usually males are the ones who answer, regardless of whether females know the answer or not, just because we usually tend to downplay what we know and what we are. And it's very important to solve this problem. It's very important first to accept that and notice that we do it, and then fight this tiny internal voice inside of us that says, that makes us do it. And this is one way to overcome it. And you can point it out with people around you. Like, I make it a point just to say, like, equally ask males and females to answer. I don't let anyone answer. I ask specifically people to answer, to try to minimize this. The other thing, as we said before, is let go of some of the weight and ask for help from your partner and from your surrounding. It's okay. That you should not feel guilty that you are choosing your career. And the third part is amplifying women's voices, and that's very important. And it has to start with each one of us doing it. So if someone around me, a woman, does something, I should be the one to amplify what she did, to give credit to what she did, to point it out, to say, bravo, she was the one who did that. so that first, nobody else takes credit for it. And second, in a way, I'm indirectly forcing her to not downplay herself. And a common saying, that women bully each other. This is one way to fight that. I don't think women bully each other, but of course, there are women who bully each other. But if we promote, and this is how the whole women empowering women came up, if we can promote this culture in ophthalmology, in medical school, in our homes, in our families, then we can definitely get to a much better place in society. At the end, I want to focus on this. Rights for women are just rights in general, like anyone else, and achieving a work-life balance is very important. All families are unique and should be able to make choices that fit them best. And that starts with both men and women asking for that. Flexible hours, job sharing, maternity, paternity leave, all of those will help not only keep talented women working, but raise a better community and society. And for ophthalmology specifically, and because it's a competitive field, and because women think less of themselves, we usually have less women applying, less women getting in. And even for those who get in, less people getting promoted because they end up shifting more towards family stuff. There's nothing wrong with that, but you should just not be forced to do that or guilted into doing that. And that's it. Any questions for me? Anything?
Okay, thank you, Dr. Amma, for your inspiring, beneficial, and beautiful session. We were honored hosting you in our event. Hope everyone enjoyed the session as well. If anybody has any question, don't hesitate to open your mic and ask or drop them in the chat box.
If anyone has any questions, even later on, if you feel like you need help with advising a career or anything, I'd be more than happy to help. You can email me or you can reach me through my Instagram page, and I can send you my email from there. It's Dr. Amma Sadaka. I also always put ophthalmology stuff on there, so it's a nice opportunity to learn more things. So feel free to contact me anytime you want. Thank you for all the messages you're sending. No questions? Nobody wants to share anything with anyone? Okay, I guess that's it. As I said, if you need anything, you can reach me through my Instagram account, and I can send you my number or my email. And you can always, if you have any ophthalmology questions, if you have any ophthalmology patients you want to discuss, I'm always available.
Yes, thank you, Dr. Amal, so much, and thank you, everyone. Hope you enjoyed our surgical insight series, and stay tuned for much more events. Thank you, everyone.
Thank you. Bye.
Bye.